At our Future of Healthcare event, Steve and Alex spoke to the future of healthcare, some of the threats and opportunities. But Alex and I thought it'd be really appropriate to come back to you and talk about what do you need to be doing now. So we developed a checklist. The first is to determine whether you are a small group or a large group. The magic number is 50, and we can help you with this calculation because even if you only have 40 full-time employees, you still may be subject to the rules for large group if you have a fair number of part-time employees because they do count in the calculation. Send us your numbers and we can help you with that calculation. Once you determine whether you're a large group or a small group, then you have a further checklist. So here on the large group side, first and foremost is taking a spreadsheet or your different salaries you're paying your employees and looking at two calculations. One is, are they at 133% or less of the federal poverty level? Because in that case, they're most likely a candidate for the Medicaid expansion, which the state of Florida recently adopted. On the flip side is if you take their salaries, multiply by 9.5%, if their responsibility for the healthcare cost is that or greater, then you may be subject to penalties. Again, the thing to do here is send us the spreadsheet of salaries. We can run this calculation for you and help you understand what is at least your exposure to potential penalties. Once you have that, then you develop your strategy. Am I going to try and mitigate, or am I just going to cope with those penalties? Do I try and make sure I stay underneath that 9.5% number? Maybe we have some of those employees that we're going to speak to them about going on the Medicaid expansion route. Last but not least is lead with narratives. Educate your employees about what you're facing and what you're doing to maintain good quality healthcare to them while also managing the cost. On the flip side, on the small group side, you still need to have a checklist. First and foremost is, what are my competitors doing? Remember, you're in a competitive marketplace where you're trying to maintain and retain your top performing employees. Obviously, your benefits package is a large part of this. Once you see what your competitors are doing, come up with your specific strategy, utilize your networks for that. And then last is, again, lead with narratives. Tell your employees, here's what we're seeing, here's what we're doing, this is what we're anticipating, and this is how we're going to manage the cost while also make sure we give you high quality medical care. A lot is going to be changing in the next 9 months. Stay in tune with us. We're here to help. We're here to help you with the new changes that are coming about and come up with a specific strategy for you to retain your top performer employees, manage your costs, and protect your profitability. Let us know how we can help.